I'm delighted we're here at our second Dementia and Palliative Care Conference at Buckfast Abbey in Devon. So the demand for knowledge and experience and expertise and sharing of ideas around dementia and palliative care. It's fantastic to see so many delegates come here. We have speakers from all over the country and internationally.
So when I think about the future of palliative care and about dementia, I think conferences like this are really important. They enable people to connect and talk to each other, and it's those in-between corridor conversations, you know, in the queue for lunch and coffee, as well as listening to the speakers. But I think I hope it also does is motivate people to go, what's the one thing, the two things that I can take back into my own practice?
It came as an invitation to speak to the work I've been involved in, which is relevant to palliative dementia care and really around communication and shared decision making around goals of care at the end of life. And while being here, it's a wonderful exposure of hearing who else is doing what in this related field, and also meeting individuals who are passionate, committed, and really forward thinking about the field itself.
I really like the philosophy behind the conference and the opportunity to come and speak at a specialist day and talk about research and practice. And so we have to really shift the conversation about providing the best quality care in the places where people want to be and where they need to be as well. And I think the hospice movement has got a large part to play in that.
My research, it comes from my clinical observations. When you see a problem, I want to do something about it. And as a physician, you do something for the patient, but I was driven to do research and to spread the word, because I want to do much more for those vulnerable groups. It's next to my heart.
So today I'm going to be speaking about the duality of caring. So that is about how you balance being both a healthcare professional and a family member. I think it's important to talk about palliative care and dementia and about the duality of caring. I was a carer for over 16 years alongside my brother and my sister, whilst also being a mother, a wife, and trying to juggle being a healthcare practitioner as well. This is the real world. This is what happens. And we need to be able to talk, think, so that all of us have our own personal toolkit to manage it.
I'm here because for the last 3 years I've been heading up a programme of work at Hospice UK that's concerned with frailty, and dementia and frailty are integrally linked, and they're a massive priority for the future of our health care in the country and across the 4 nations.
I think what we want to do is we want to integrate this notion of holistic care, where we recognize that the individual who's living with a terminal condition such as dementia is on a living, dying journey, and that we have the appropriate supports in place as they make the transition from living to dying to death. And that is not only in terms of supporting the person living with dementia, but also their family members, and also those individuals in terms of formal healthcare providers as well.
But it's always good to come along to these events and refresh your knowledge, to look at current research and any new interventions, and it's been really informative. It's been great to listen to some very eloquent speakers, some very emotional and touching stories. So it's been very enlightening today, and I'll definitely be taking things away from today to put into practice.
We've got a massive, diverse group of people who are really interested and passionate about making sure that we take really good care of people who've got dementia going forward. We know that we've got an enormous number of people who are going to have the need for this care. We're learning more about it all the time, and hospices have a massive part to play in taking care of people as they become more unwell. So it's about upskilling people without the hospice building, and ideally working into care homes, residential homes, and people's own homes.
I really love the event because people talk about things that matter, and they all click together. And so there are all things that matter for practice. I think everybody learns new insights, you discuss insights, and I hope people tomorrow when they go back to the hospice or the hospital or their care homes, they will use this into practice.
I think coming away from this, I'd like to share with the rest of the team what we've learnt from today and make sure
Everyone's aware, isn't it?
Yeah, basically aware of it.
Yeah.
And it's a long day ahead of us, and we'll get some more wonderful ideas and that would influence our practice.
Not only make knowledge, but spread the knowledge and use the knowledge.
It's just been a fantastic day. listening to all the speakers, for people talking about dementia and palliative care, the interventions we can make collectively and individually to make a huge difference to those living with dementia. So pleased that the delegates and the speakers has had such a fantastic day, and hopefully we look forward to doing this again next year.